Hey guys, welcome back to the Stretch Mobility Coaching Podcast. And today I am excited to say I have a lot of information on why your hips are so tight and what is actually happening inside your hip joint. And I've got a lot of stuff to go over today, so I'm just going to dive right in today, okay? So if any of you guys have been experiencing hip symptoms, and if you're not sure why they keep coming back, even though you've done everything you've been told to do, I want to make sure you know what you're up against when it comes to your hip and your hip joint and why it is tight. And more importantly, I want to show you what will actually work to get back the end range mobility that you are losing right now and to get rid of those symptoms in your hip for good. Here's what you're going to learn today. You're going to learn why your hip feels the way that it feels right now and what is actually causing those symptoms. You're going to learn what the research is saying about what happens if this goes untested and unmanaged. And then you're going to learn what you can do right now to start protecting your hip mobility. You're going to learn when you need to address your hip so that it does not become painful or damaged to the point of surgery. And I'm going to share a freebie you can download to help you identify deficits in your hip mobility. So your freebie is going to be called the 4 Easy Steps to Find Out If You Are Losing Hip Mobility. And I'll put a link so that you can download that in the bottom part of the show notes. So let's start off the show today talking about the symptoms that you are feeling right now. Some of you are feeling a weird feeling in your hip when you bend over to put on your socks, or it's tight, or maybe you're just feeling tightness when you're sitting. When you go to stand up, you feel like you have to pause a second. And some of you are choosing to modify what you're doing right now because your hip does not move like it used to. Most of us consider these signs to be a normal part of getting older. But guys, this is much bigger, and it is a sign that your hip joint is in what I call decline. Now, here are the current trends. Most of us do not see the signs that our hip is tightening until we experience that tightness, or some of us wait till we have pain because we don't know what to do, or you've tried many things and you don't know how to get rid of that tightness besides your general stretching and strengthening programs. And when pain shows up, the go-to responses are usually the same. Go get a massage, start stretching or go to a stretch center, foam roll the area, perform a hip opener so you can work out, or many of you are taking anti-inflammatories. You may go to the chiropractor for an adjustment, or you may go see your local physical therapy clinic. For each of these treatments, you feel better and you think you've done everything you can do for your hip pain or your tightness. But what if the pain or tightness or lack of hip mobility that you're experiencing today is completely reversible, and the things that you're doing that are called treatments are really just that? They're a treatment for relief. We're going to dive into this today. I want to look at the hip joint, its function. I want to talk about what is happening that is causing you to feel that tightness in your hips and why you feel stiff, or why your hip is not moving like it used to move. So let's talk right now about what is actually happening inside your hip. Now, when I refer to your hip, I actually refer to the bone, the head of this is the femur, the head of the femur as it goes into the socket into the pelvis. This is where the actual joint capsule is, and we're going to be talking about the hip, and this is what I'm referring to, okay? I'm not referring to your pelvis. I'm referring to how this bone is centered inside the joint capsule and inside the pelvis. Now, this hip joint moves in several different directions. It moves into flexion and extension, internal rotation and external rotation, and it also moves into abduction and adduction. And between many of these movements, you should also be able to do a full circle with your hip in both directions. But this takes several of those different motions to achieve a full circle. And flexion, extension, internal rotation, external rotation, abduction, and adduction are all medical terms for what direction your hip moves in. And when it moves through all of those ranges of movement, it should be coming from this femoral head moving cleanly inside the joint capsule. Now, the femoral head is supposed to glide downward when your hip flexes, and that means when your knee comes up, the hip flexes, and this bone glides downward in the capsule when your hip flexes. It's supposed to have space anteriorly when your hip moves into extension. And what that means is if your hip is going backwards, I don't even know if I can get it in here. If your hip is going backwards here, it needs space in the anterior compartment of that joint capsule when your hip goes into extension. And it is supposed to move medial and lateral to achieve your abduction, which is going out to the side, and your adduction, which is crossing midline. Now, hip internal rotation is supposed to move into the anterior capsule and the inferior capsule, and external rotation needs the space from the posterior capsule to move through its range of motion. And when you move in a circle, the bone should actually be centered in the socket the entire time. Now, when your hip has lost end ranges into all of these motions, that means the capsule that surrounds that bone is tight, or it's better known as a restricted joint capsule, which is in that part of the joint capsule. Now, when a restriction is found in those parts of the hip joint capsule, this is what I call hip joint decline. It means the bone is no longer fully supported by the joint and muscle system that is around it. Okay, so let's really define what this hip joint decline is. Hip joint decline, it's when your hip is losing end range mobility in all of the motions that I just talked about. And it's supposed to move in every one of these motions to the end range. That's what you came to this earth with, and that's what should be happening. Now, the joint capsule is tightening around that femoral head, causing limitations in how your hip joint now moves. When the joint is in decline, that's what's happening. This bone that is the femoral head is no longer centered in the where it's supposed to be with the capsule and the pelvis. And so this is the decline that I'm talking about. Now, this decline is an inefficiency in the joint and muscle system. And this inefficiency causes a cascade effect in your nervous system and the muscles that surround your hip joint. Now, you're not going to feel any pain at this point. You're not going to have a diagnosis. There's nothing that a doctor or a PT or a chiro can label at this point. Medicine doesn't actually test for hip end range joint mobility loss. Medicine's test wait for dysfunction or pain. Now, when you lose end range hip mobility and your hip begins to restrict that mobility, that is a hip joint decline, and it's completely invisible in our current healthcare system. So let's talk about the chain reaction that occurs when your hip joint is in decline. It's no longer centered where it needs to be centered, so it's not moving like it's supposed to, and you've lost end range mobility. When this happens, your nervous system detects that the hip joint is restricted, and that restriction triggers a chain reaction. Your deep muscles that stabilize the hip bone to stay centered it's called inhibited. Okay. I say that they're just shut down. The larger muscles that are supposed to move that hip joint so that you can go and take it into flexion, extension, abduction, adduction, internal and external rotation, those larger muscles go into what we call a holding pattern so that they can stabilize that joint because the deep stabilizers are inhibited or shut down. And those larger muscles were built to move the joint and not stabilize the joint. So they're going to get tight. And when they stay tight and you keep moving every day, over time, your body begins to compensate, further requiring your low back joints and muscles to assist with the joint mobility that is lost in your hips. Now, when your low back can't compensate anymore, that is when you're going to experience that low back pain. You're going to have tightness at that time and sometimes some pain in the hip. And that is the first time that you're going to feel something, okay? And this is not a muscle problem, but the treatments that you get are going to release the muscle. Guys, the muscle isn't the problem. The joint is the problem. And your muscles are reacting to that joint problem. And that cycle does not stop until you address that joint mobility loss, okay? So let's go a little deeper into this chain reaction. So like I said, when the joint it isn't centered like it's supposed to, and you've lost that in-range motion in all of those movements, your nervous system communicates directly with the joint and the muscles around that hip bone. And the joint muscle complex is what I refer to as the hip movement system. And your hip movement system, to work effectively, must support the joint capsule. The femoral bone should be centered into the joint capsule and allow for full joint mobility into every one of those movements. And when that joint capsule restricts, your nervous system is going to activate what the medical system calls the arthrogenic muscle inhibition. And a lot of people call this AMI, okay? AMI refers to what happens to your deep muscles that support the joint capsule. When in-range hip joint mobility is lost, the deep stabilizers that support that joint capsule, they're inhibited, they're turned off, and they are no longer recruited to support the hip joint capsule anymore. And that puts your hip joint capsule in what I call that decline. Now, the medical term they use is muscle inhibition. Now, the larger muscles that were designed to move that hip are now told to hold it instead. Muscles are built for movement. The ones that are built for movement cannot sustain the demand of stabilization. They fatigue and they tighten. And when those muscles stay tight and you keep moving the same way you do every single day, those muscles are going to become sore. Then your body pulls end range movement from the low back. And this is typically pulling from L4, L5, and S1. Now, this is why 1 in every 2 adults will experience significant low back pain in their lifetime, guys. And this is because we lose this hip joint mobility, the end range of all of those motions, starting in our 20s. Now, many of you right now have low back tightness when you wake up in the morning. That means the decline cycle is running. Most of you guys are going to feel tightness in the morning. You're going to move around, and that stiffness or tightness, well, it seems to go away, right? Well, the tightness or stiffness doesn't actually go away. I want you to listen up and learn what is actually happening so you can be better prepared to take action so that this cycle doesn't continue and actually accelerate. Now, what most of you don't know or have never heard is that the hip joint is in decline, and that decline, once it starts, it does not stop. It doesn't stop if you stretch. It doesn't stop if you foam roll. Just because you feel better and you don't feel the tightness, just because you strengthen larger muscles, just because you decide to massage and get instant relief, those muscles around that hip joint are only going to provide you with temporary relief because the underlying problem, which is the hip is in decline and that hip joint is in decline. And that chain reaction from the hip joint decline that starts what I call the silent shutdown of your deep muscles to the larger muscles losing muscle function and health, this chain reaction causes you to lose muscle mass. And when you lose muscle mass, you actually lose the function that the muscle was prepared to do. And this function is altered and it does not perform the same way a healthy muscle performs. The joint and the muscle are the system that controls this decline. And this decline is progressive and it requires a different technique and a completely different testing and process to stop and preserve what you already have. And there has to be a whole different process for you to rebuild that. But guys, we do have research that supports that you can reverse this and you can rebuild it, but you can't do it with stretching and you can't do it with strengthening or massage or reactive care techniques, because the joint, muscle, and nervous system, they work together to communicate when this decline is initiated. And all three need to be addressed fully to restore the health of the joint and the muscle complex. This, again, is what I call the system. And when I talk about the hip, it's the hip movement system. And when this system is no longer working efficiently, you're going to feel like nothing is working right, like something's falling apart. You're going to feel temporary relief when you seek treatments from fitness or healthcare providers, and you will not be able to address the system as a whole when you get a treatment, because treatments are designed to give you a quick relief. You're going to need a provider that works with the entire system, understands the system, can test it, and find out what joints are actually restricted, what joints are not restricted. And further than that, you need to know what level of decline you're in and what you're up against. And this is why I developed and now provide a testing and a complete system to actually reverse this decline, to help you manage the decline so that you don't continue into a more progressive decline. Now, I also train others to become stretch mobility coaches so they can provide care in this system. So let's break down what dysfunction is. And I want to show you the difference in decline and dysfunction. Now, if you've ever experienced the stiffness or the tightness that we're talking about in your hip, but you don't experience any pain, and maybe you went to a chiropractor to fix it, or you saw a doctor to see what is going on, you may have gotten x-rays and were told nothing is wrong, which means you don't have arthritis or a diagnosis. Have any of you guys ever experienced that? Well, your doctor did not miss anything and your PT didn't fail you and neither did your chiropractor. They were all looking for dysfunction and they did not find it because dysfunction has not happened yet with your hip. And guys, that is good news because in most cases, we wait for pain to seek treatment and our healthcare system doesn't test for hip joint decline. What is happening in your hip joint is decline. It's silent, it's progressive, and it is measurable. Now, our healthcare system doesn't have the testing for this decline because this system is built on a fact that you will wait for hip pain to seek care. Most of you are going to wait for your insurance to cover your hip pain. Guys, hip pain is a dysfunction. Hip joint decline is the gap where I work in. And this is the area that is emerging as a way for us to keep our mobility healthy so that you don't lose your mobility. Dysfunction, disease, and injury are areas that can be tracked in our healthcare system, and you can use your insurance card for that. And it's a good thing that we have a way to track those metrics. But for those of us that don't want to wait for a dysfunction or diagnosis, let's break what dysfunction is down, okay? Dysfunction is categorized by our healthcare system when decline has progressed far enough to be visible and painful. This is when it is diagnosable. And a doctor diagnoses hip osteoarthritis when imaging shows cartilage loss visible on an x-ray, but the cartilage was wearing in the wrong places for years because the image didn't show anything when you had that first x-ray, because at that point you were just in decline. Now, a PT is going to diagnose hip impingement. And this is when the femoral head is already creating contact with the acetabular rim, but it was losing this centering long before you had these symptoms. Now, the diagnosis itself does not create the problem. It actually names a problem that has been running without a name. The bone lays down extra material at the joint's edges to create stability the muscles can no longer provide because of being in that AMI, the arthrogenic muscle inhibition system, which I call the silent decline system. And this is how you actually start building bone spurs. This is where bone spurs form. And many of you guys don't know those bone spurs are forming because your joints are in decline. And if you get the hip joint centered back into that capsule, your body no longer has the need for the bone spurs to grow. So that stops growing because it doesn't need that extra stability, because you have the stability you need if you're working on the correct things. Now, when you are in dysfunction, the joint space around this femoral head narrows. That increases inflammation, and that becomes chronic. Cartilage is going to load unevenly in your hip joint. And guys, most of us, when we start feeling this, is the first symptom is going to be stiffness or tightness, but the very first is going to be something is just off. And you're going to feel, if you lift up your foot or do some other things, you're going to be able to see this. And again, down below the end of this podcast, I've got a free download for you, and you can download a simple test to see what's going on in your hip right now. Now, what is happening is a mechanical result of a hip joint being in decline. And this is where testing, before I invented that, testing was never something that the healthcare system was able to do. It actually, because we weren't getting this hip joint tested, it progressed into a dysfunction. Now, I want to dive into what the research tells us about hip joint decline. This decline, again, has a scientific name, and it's called Arthrogenic Muscle Inhibition, and that is AMI for those of you who want to look that up. And the research on this is clear. When a joint loses in-range mobility, the nervous system inhibits the muscles that are supposed to support that joint. That's what I call deep muscles. That is a documented neurological response, and when the hip joint decline goes unaddressed and untested, it progresses into a diagnosable condition. Now, let's go over some of the most common dysfunctions, and let me know if you've ever heard of any of these. These are actually conditions that come from unaddressed and untested decline. IT band syndrome, piriformis syndrome, hip bursitis, hip osteoarthritis, hip strain, labral tears, chronically tight hamstrings, chronically tight quads, and chronically tight hip flexors. Now, here is the research statistics I want you to hear. Over 1 million hip replacement surgeries are performed in the U.S. every single year because hip joint decline is not measured and reversed before it progresses to a diagnosis like hip osteoarthritis. Many of you have been to your doctor with test results that state your hip is bone on bone. That's what this is. Now, 80% of adults will experience significant back pain in their lifetime because their hip mobility has lost more than in-range motion and because of this accelerated decline. 1 in 4 adults over age 65 will fall each year, and hip dysfunction is a contributor to that fall. Guys, wellness spending is at an all-time high, and surgery rates keep going up despite us getting treatments for wellness. Guys, these are not inevitable outcomes. They are the result of a system that waits for pain before it acts. Healthcare tests wait for you to have pain and dysfunction to give you a diagnosis. You have been taught to measure your movement health by how you feel. So you assume no pain means no problem. And that is exactly how decline becomes damage without anyone catching it in time. And this is why our mobility health score matters. And that is the test that I created. It is the only way for us to measure what is actually happening in your hip before it becomes something your doctor can see on an x-ray. So now that we've discussed hip joint decline, the cycle that occurs before dysfunction and disease, let's talk about what options you have today to stop your hip joint decline from progressing into a problem. I've created a way to test this hip joint to see if you're in decline. You should not have to wait until your hip hurts to find out if your hip joint is in decline. In fact, you should not wait for dysfunction. If you already have a dysfunction or a problem, getting tested will provide you with a way to control that progressive decline so that you can be in control of your decline. Before I created this testing, there was only waiting for pain, then seeking care from our healthcare system. And for many people, this could take years. Then you followed treatment until your hip was bone on bone. I saw this way too much with all of my clients. And since I created this test, I've been able to help people move better because we keep their movement system working efficiently. And the test that I created called the Mobility Health Score, that is what is measuring the health of your joint to see if your joint is in decline right now. Now, what we're looking for is end range loss in your hip and restrictions. And when we identify that loss, we can actually restore what is lost in that joint mobility using the stretch methodology. And the stretch method is a system that restores end range joint mobility through specialized techniques and programming. And only certified stretch mobility coaches that have earned the credential of a master stretch mobility coach have been trained to perform this testing. Now, after we get your results, you're going to be given your scores and you're going to be given a movement age. Most of our people try to guess their movement age and many are pretty close. And after testing is complete, we use specialized techniques to open up the joint capsule and center the bone. This allows for instant joint mobility in all ranges of motion, as we discussed earlier in the show. Now, your movement health score tells you exactly where the decline is. It also gives you a movement age, and it tells you whether your body is running efficiently or if your body is actually working harder than it has to because the hip system is having to do more because the bone is no longer centered and the joint capsule is restricted. And this joint restriction is the start of hip decline. And this restriction leads to a cascade effect that is silent and does not stop until your hip is bone on bone. So I want to break down this testing, okay, this mobility health assessment. It provides you with a mobility health score, and it tests your hip joint, how it moves currently. It looks for restrictions in your hip mobility, and then it gives you a mobility score. We call this the mobility health score because we calculate how many of your joints are not in decline and moving in a healthy way that have lost end range mobility. Now, here's what the scores tell us. A score above 80 means that your joint mobility is healthy, and scores lower than 69 show that you are in actual joint decline and muscle decline. And this score shows you that you're at risk of losing the health of your joints and muscles. That means the bones are already not centered in the joints and they're not moving and gliding like they should, and they're not working efficiently. Scores below 59 mean that many of the joints in your body are in decline, and this is putting a severe strain on your movement system. Numbers below 59 usually are those of us in dysfunction. We have had or are experiencing pain currently, and this is when the movement system becomes progressive. Not testing or reversing now will lead to hip bone on bone and ultimately a hip replacement. This is not something that you have to live with anymore, and it's not something that has to end in surgery. But you do have to get tested. You have to know your numbers, and you have to address what the numbers show before you have the dysfunction or damage. Now, we found that people that come in and are tested, that track and do the things that they need to do, can stay in control of this decline becoming progressive. And our clients feel in control and have not had any hip surgeries. We track this for our clients that stay on with us, and we track their hip joint health. Now, hip joint decline can be identified, it can be measured, and reversing it is going to give you the ability to stop how progressive the silent decline can result in for you. Now, guys, I hope this information better helps you understand your hips and how to keep your hips healthy throughout your lifespan. It is my hope that you will keep your hips healthy so that you can move and do all the things that you want to do, even if you're in your 80s and beyond. We now have control to keep our hip joint mobility for life. Raise your hand if you want to keep your hip joints healthy for life, because I am here to show you how. So here's where you start, guys. If you feel like your hips are in decline, but you want to get tested, or even, guys, if you already have pain and you've already been to PT and chiro, but it's just not giving you the end result you're looking for, then come in and let me test your mobility health score. Let me show you what your movement age is, and let me show you exactly where your hip is in decline, and let me show you how to stop how progressive this decline is. You deserve to know what you are up against, and now you do. Now, I'm going to put a free download below, and it will give you 4 easy steps to see if you need to get tested. And I also have placed a link below for you to schedule your Unlock Healthy Joint Mobility session so you can gain control of your hip health today. Guys, I can't wait to see you in the studio. And next week, I'm going to talk about the foot again. And if you look back at the last 4 episodes, I really dug deep into foot and foot mechanics and shoes and talked about barefoot shoes. My next week's podcast is going to be on the foot again, but it's going to correlate the foot and the hip. So I'm excited for you to listen to the next podcast. Guys, if you felt like this information was helpful for you and it made sense and it gave you the answers that you wanted, please be sure to share this out to friends and to family. Thank you so much for joining me today, and I can't wait to see you next week. Until then, keep moving well. We'll see you next week.